Okay, good afternoon, everybody, and welcome to this public accountability meeting, the first one of 2021. I don't think we have any apologies other than Chief Executive Officer for the OPFCC. The minutes of the previous meeting are on the, well, there aren't formal minutes because we record these sessions and anybody can go back and listen to them as they so wish. We do have today a number of questions from members of the public. There are 1, 2, 4 questions, and they're quite long. So what I propose to do in order to give a full answer is to go through the agenda and through the presentations, and we will try and answer those questions as we go through the presentations. And then at the end, we will recap those questions and just ensure that we have answered them. So that's how I'm proposing to do the public questions today, and in that way you can get a full answer to those questions. So I think the first substantive agenda item, Alan, is your offender management presentation. If you could just introduce yourself a little bit first, that would be really helpful.
Good afternoon. I'm Allan Harder. I'm a detective superintendent with North Yorkshire Police, and within North Yorkshire Police, I'm the head of safeguarding. And within that includes the offender management unit that deals with and manages registered sex offenders and those that would fall into what perhaps are more traditionally known around the integrated offender management offenders, and also around domestic abuse in relation to that, which will form part of the presentation that I have for you this afternoon. Okay, so I think we've got the first slide. Thank you. So the purpose of the presentation is to give you the assurances that we are dealing with and responding to offenders across North Yorkshire and the offender management of those. And split the presentation into 2 elements. The first part is around offender managers within the integrated offender management arena, which I'll explain the North Yorkshire approach that we have taken and are taking. And then the second part of the presentation is around how we are dealing with a cohort of domestic abuse offenders in relation to that and the matak. So if we can go to the next slide. Okay, so So in relation to offender management, in 2020, Her Majesty's Inspector of Probations, along with the HMRC FRS, the organisation that inspects police and fire and rescue, completed a joint thematic inspection around integrated offender management. They came up with identified 3 areas of improvement, and that was to address 3 key areas, which one was around unclear decision making within the processes. Second, around difficulties and delays for offenders gaining accesses to services. And most importantly, the rehabilitation work that is being completed by police rather than partners under the old schemes. And in essence, the old integrated offender management element to it lacked a degree of focus, the joined up working in relation to that. So in response, North Yorkshire Police developed a scheme called Trinity, which is designed to look at support, interventions and disruption with those offenders. Okay, it was a new, fresh approach that was being delivered, and it's designed to manage those offenders that are causing the most harm to communities across North Yorkshire and the City of York, with this bespoke pathways for that individual's needs, as opposed to everybody goes through the same process. And the purpose of that was to tackle those areas that had been identified in that thematic report, reduce the impact that the crimes were having and the offending, the reoffending and the continued offending that these offenders were committing. Importantly, to reduce the number of people who were victims of crime and improve the public's confidence within our approach and also the criminal justice system in relation to that. As a result of delivering Trinity, which was introduced prior to the HMIC's FRF's inspection, we have been able to meet many of the objectives within that project. Okay, it is a tri-agency initiative, so that is an equal partnership between police, the probation service and prisons, bringing together our responses to do that. And what this scheme allows us to do, and partners to do, is for them to refer individuals into Trinity for either adoption, to support, intervene or disrupt, to reduce the impact that they're having in relation to that. And then once they're adopted onto the scheme, certain pathways can be identified, which I'll come on to later on in the presentation. Whilst just dealing with the adoption side, there is a threshold that we use for people to be adopted onto the scheme, and that is using the Cambridge Harm Index, which is a nationally recognised model for the management of offences and the frequency of that, which looks at the period of 5 years that somebody's been offending. We've set a benchmark of a score in relation to that. So agencies will make nominations. It will come into a scoring panel in relation to for adoption or not adoption. And if it meets the threshold, they will be adopted onto the scheme. At that point, one of our offender managers will engage with the offender and explain the benefits of the Trinity scheme to them. And it gives them the opportunity to engage. We identify the bespoke pathways for them, and it gives them the opportunity to change from their previous actions around offending. If they're adopted, if they agree to work with us and our partners in relation to reducing their offending, we will facilitate those pathways with them. If they don't, though, and some people don't want to work with us to stop their offending, we would then go straight into that disrupt model, where their details would be shared with local commands. They would form part of the daily management meetings, so that there can be that disruption towards the offending that they're committing. And equally, if they don't meet the threshold to be offered a place on the Trinity scheme, that will go back to the originating agency organisation for them to manage that individual. But we don't just stop there. What we will continue to do is keep an eye on that individual, and we monitor them. And if they do come to that threshold where they can be adopted, we'll go back through that formal process to do that. So they're not left, they're not abandoned. There is that continuity with that in those individuals, which is important.
Allan, can I just stop you there? And I know you'll come on to this, but you know that I've always had concerns around some of this. And I suppose what I want to see, I'd like to see, is the evidence base around the effectiveness of local teams managing some of these offenders, because in effect you're just passing them back to local teams, and historically that working between IOM, or Trinity as it now is, and local teams hasn't always been as effective as it could be. And so and I, I'm concerned around some of the sort of lower level stuff that's going on at the moment, and it's really making sure that people are not slipping through the net here, and are not being dealt with. We've had conversations about this in the past, but it's that assurance around that, because my concern is that Trinity has been developed in a way to manage the numbers of offenders, because police resources are not infinite, but those lower level repeat offenders that heap misery on communities and local neighbourhoods are really important, even though they don't meet some of the more serious sort of thresholds.
No, I understand that, and you're right. We have discussed it on a number of occasions about how that is managed. Certainly, Trinity is not a scheme just to manage the numbers. It's a scheme to make sure that we identify those offenders that are presenting harm to communities, which is obviously where we're both in agreement to do that. What it does is it adds that additional focus to those individuals, whereas before we had large numbers who were seen in many respects almost on a revolving door. They'd come out of prison, go back into prison, and where was that true level of intervention that we were having with it before? And that's why we looked was what was happening nationally, some of the schemes that were working better than others, and this was certainly one of the schemes that we've seen and provides that element to it. And the disruption side is why it goes to commands, because within the offender management unit we don't have a catch and convict unit, which is seen in some other forces. It's around that disruption and engagement and at a command level, which the expedite teams have been able to deliver for some of those prolific people that you would refer to who are causing those harms on areas. Okay, and equally, when that offending occurs, their score is likely to increase. So although they're not being adopted, if they're still being disrupted, we would see that, and then they'd come back, and then we'd be able to get them picked up, or they could be referred back into Trinity again in terms of that. So that it isn't a closed door. Once they've been made the offer, they can come back.
I know. I mean, there are those, though, that, of course, just flat refuse to cooperate. And, you know, they can be some of them quite challenging people. And so, you know, it's just ensuring that these people are really focused on, because Trinity has a sharp focus on these particular individuals, and once they go back into local teams, those teams have got lots of things to deal with, and it's making sure that these people are really kept an eye on.
You're right, there are competing demands across the force, and we need to balance those, and the offenders is one of those in terms of how we do that. Are they drug users? Are they committing crime for other reasons, such as burglary? We need to understand that and understand that so we can either disrupt them and target them, and this where it leads to some of those pathways. So there are a number of identified pathways that we've built and developed with our partner agencies, which when they're in place can be quite significant in reducing people's offending, and we've listed them there around accommodation. Stable accommodation is really important about reducing people's offending, likewise with education, training and employment. But what's causing crime, what's feeding that drive for people to commit crime? Well, it could be around drug and alcohol issues, mental health, and some lifestyles and the associations that they're with. So by having those clear, set out and agreed pathways with an offender that we will deliver that to them, actually reduces the offending that we've seen, and that's what we're able to deliver for them. And it's very much, if you engage with us to tackle your offending, we can work with our partners to deliver this, and we have seen those successful results within that. And you're right, there are people that don't want to engage, and it's right that we continue to disrupt them, but that doesn't mean we give up. Actually, if they go back to prison or they end up coming out of court, we will continue to look at them. They can still come back to be nominated through the respective agencies or the agencies that got statutory responsibility for the management of them, to try again and still try and get them around that support and intervention element to it to stop them committing further offences, which is really important for the communities across North Yorkshire and the City of York. So
sorry, can I just bring in at this point, because it seems quite a good point actually, to bring in one of the questions that we've had from the public.
Yes.
And that is from somebody called Andy, and he says he has a son who is an offender. What chance do these people have of rehabilitation when almost every time he goes about his business he's stopped and questioned by the police, stopped in his car for no reason, visits to his house, he accepts his past, but it's difficult to move forward when he faces constant interest from the police, and he is told what you expect with your past. So that's an example from a family of an offender's point of view. And I have to say that's not the first time that I've heard that sentiment expressed to me.
I mean, I can answer that question without being specific around that, and the reason for that, I think, would be inappropriate to be specific around that individual, because we don't know the full circumstances in terms of that. But certainly, what would happen is when somebody is adopted, they would be working with the integrated offender manager who within our offender management unit around tackling those areas and pathways. We also need to understand the way that the policing is intelligence led. So, in terms of how we respond to intelligence that comes in and deal with that. So if we are speaking to people, whether or not we are conducting a PACE search, and I know that's featured before within the public accountability meetings, we need grounds for completing a stop and search in relation to that. So we will be supporting people. We do support people. But if there's information that people are committing offences, it's right that we disrupt in relation to that.
Thanks.
So it's unclear.
I think the Chief wants to come in, if that's all right, Allan.
Certainly.
Thank you, Julia. And I suppose just to add what Allan said, in those circumstances where somebody's on this scheme, there would be that intervention and relationship and conversation with the individual. And we don't know, without asking further of the person that's posed the question, that perhaps their son isn't on this sort of intervention or this sort of scheme, and that they have had previous contact with the police, and now they are not connected with any sort of probation or scheme, and they are out at liberty living their life, and feel that they are being challenged by the police inappropriately feels to be the intent of the question. And I would suggest we ought to work more closely with people. As you've said, Julia, this isn't the first time that we've had this issue raised, and it's about understanding the perspectives of the individual involved, and is it possible for them to share their experiences with us so that we can share with our officers and staff how their actions might affect how the public feel. It's a little bit like any other rehabilitation conversation. I'd really welcome if the individual that's posed the question is willing to get back in touch with us, is to see if we can use his son's experiences in our training, in our communication with our officers and staff, and maybe create a mediation opportunity to sit down with that individual and understand how it feels from their perspective. So I do think there's a lot more we can do in these circumstances for us to put ourselves in the shoes of the people that may have turned over a new leaf and want to get on with their lives and feel that they're inappropriately being stopped by the police. I think is equally as important for us to understand, alongside those that are on formal schemes. So I'd really welcome if that individual wants to get back in touch with us. I'd be really interested for us to use those experiences in some of the ways that we train and share that experience with our staff, so that they've got an understanding of how that feels from that person's perspective.
Yes, I mean, thank you, Lisa. I mean, it also comes into things like sort of stop and search and all of that sort of stuff as well, and making sure that that's used properly. I, as a commissioner as well, I think I have a responsibility to think about the types of support services that I can commission in local areas to provide support to people who are wanting to rebuild their lives, and certainly we are looking at that in some areas at the moment, and it's a particular concern for young people. You know, that I think is something, if we're thinking about preventing crime, is something that we really need to get better at. And I think that's not just the police. I think that's across the border. There's some fantastic charities like the Prince's Trust, for example, that do great work. And it's trying to make sure that we utilise all of those types of schemes that are available to us to provide support to people so that they can rebuild their lives. You want to go on, Allan?
Thank you. So just in terms of the pathways that I've talked about, we've got they follow 3 elements to it: support, which is about the rehabilitative pathways that encourage people to work with ourselves and the non-statutory partners, and obviously you're aware, Commissioner, about the work that we're doing about some of the interventions and the commissioning of services in support of that, to make sure that they're available as well. And actually there's some really good opportunities as we move forward in relation to that, which is really positive. When we also then look at interventions, okay, we have a very structured approach in relation to the interventions with our people on the cohort. So there is that early screening and adoption meeting, and every fortnight there is a review of those cases that is taking place at a local level. So that is reviewing whether or not there's been any further offending, which is really important, whether or not there's any further intelligence that would suggest that there is further offending as well. And that then goes through to make sure that we are following the pathways that have been agreed with the person on the cohort. That then takes us through that when all those pathways are being delivered, they will be rescored at the end. And with those cases, we've seen those reductions in the Cambridge Harm Index score, which is really positive because that shows us that the scheme is working in relation to that. What we've started to do very recently is around looking at, actually, do we need to rescore them in that interim period of time to see what's happening? There wasn't the belief that was necessary before because we've got those regular reviews taking place, up-to-date intelligence, daily management meetings, and then the fortnightly reviews. But that's something that we've introduced. So if we do see something starting to change or the information that offending is taking place, we can have the early intervention in relation to it. And that doesn't stop when when the pathway has been completed. If we start to see intelligence about somebody who's been on the scheme that is going back towards criminality, we'll reach out, we'll have the intervention with them and make sure that those pathways of support are still in place, and if they need any additionality for that, because we want to prevent people going on to commit further offences when they manage to break that cycle, to make sure that they stay where they've successfully achieved to get themselves before. So we don't just stop when they come off, we keep following, flagging and monitoring that cohort of people that we've had before.
Okay, so Alan, can I just pick up on that 72%? So of the 32 deregistrations, 72% have not reoffended since. That is a good figure. So I think you should highlight that because that is extremely positive. And
it is. We've got a smaller cohort of people from where we were when we first gave you a presentation about this about 18 months ago. And because it's a smaller cohort of people, we're able to be more intrusive, more impactful, and concentrate our efforts on those so that we've got a more sustainable solution for them so that they become resilient themselves and be able to look after themselves, which is really important because I see that if we are able to reduce the adult offending, their children's prospects increase as well when we start to look at acute childhood experiences, the impact of domestic abuse and breaking that cycle of criminality that we see. And that is a really great result in relation to that. And I think if we've been able to reduce the offending impact of those, with 90% of them having lower scores, that is across the board. So that might be they're not committing the same type of crime, but the level of crime that they're committing is reduced in terms of the victim harm that it's causing as well.
And Alan, have you got any benchmarks around how this compares with other areas? Because 53 active cases doesn't seem like a huge number, but that might be because but the success that you're having might be directly related to the fact that that isn't a huge number, but then that's related to your overall resourcing of the function. And how many offenders are out there who are not part of IOM that are still continuing to offend, if you see what I mean? So that's good, but there's a broader picture around all of this that would be interesting to understand a little bit.
I understand the question fully. In terms of benchmarking and where we are, there isn't a defined minimum requirement as to what IOM should look like nationally across the country. So it would be very difficult for North Yorkshire to compare our cohort against another forces, or even those forces that are classed within our most similar forces cohort nationally, because different people have got different models and they bring into the cohort very different groups of people. So it'd be very difficult to turn around and say, this is where we are benchmarked against other forces in relation to that per se, which I think is one of the challenges that we've got in relation to IOM nationally. You're probably aware there was a new IOM strategy released November, early December, that we are looking at that at the moment to see where that benchmarks against Trinity. And The content of that isn't a million miles away from where we are and what we're delivering already. We just need to tweak it in some areas, and there's some ongoing work in relation to that. In terms of numbers, in terms of our wider offender management that we're looking for and the responsibility of those officers, and that 53 that you talk about, this isn't just the offender managers don't just deal with the IOM. They're also involved with supporting and managing the just under 1,200 registered sex offenders that we've got across the force, 780 of which are active. We've got about just over 100 that are on reactive management, and we've got others that have been detained within custody. So that cohort of those offenders within Trinity, those registered sex offenders, we've got 23 staff managing that cohort across that. Okay, we do have a Trinity lead in each of the areas, the 3 geographical areas, with dedicated sergeants who manage them as well. So we've got a sergeant in each geographical area managing the registered sex offenders and the Trinity cohort, which, as a result of the investment that we've been able to receive from yourself through the previous precept work, we've now been able to ensure that all of our offender managers are dealing and managing offenders within the safe handling limits in terms of ratios around the cohorts. So there's some recognised national standards around the number of offender managers per offenders and the levels of risk that they all present. So as a result of that, we've been able to make sure that our staff are safe in terms of their welfare, and because of that, they themselves will be able to manage and effectively manage those people that they've been charged with that responsibility to complete, which has really made a lot of difference in relation to that team and the feedback that we receive in relation to that.
Okay, so that's quite, Alan, sorry, that's quite an important point then, because that was additional tax that I raised from the public to support this area of work. And it would suggest that 72% not reoffending is a high statistic, that actually the resources in here are starting to make a difference now.
It's delivering at the front end where we're starting to see that difference. So in terms of the of the 32 that have been deregistered, 72 have not reoffended, which is great. But that's because we've been able to make sure that our officers are dealing with the right numbers. They're able to deal with it in the right level of detail and concentration, so that we can look where we need to look, focus where we need to focus, and deliver with those people that they need that help and support with, as opposed to larger numbers where that perhaps previously could have been considered as a lack of focus in areas in relation to that. And of course, we've implemented some other elements to that around the polygraph role, which has been up and working in terms of managing the risk that some offenders present in relation to that as well, which again is a result of the investment that you've made within this key area of policing. We still have some challenges as we go ahead. If we go on to the next slide, and probably the last 12 months or just under 12 months in light of COVID has presented some of those challenges, not only to us, but with some of our partner agencies as well, as we've seen across all areas within the country in relation to this. Where we've not been able to make contact with some of our offenders, or those offenders that present as a lower element of risk, we've been making contact with them by phone, by Skype, because we know some of our offenders are shielding by themselves, by their own medical issues that they've got in relation to it. We've still been able to maintain support and work with dedicated drug and alcohol workers, housing officers, and we've also looked at links in terms of community sports as well, where that's been possible. Our partners in probation, CRC, have now got designated officers to present the cases into Trinity, which is really positive and reflects their engagement and equal engagement into the scheme, as opposed to what the national thematic had identified previously, that it was just generally police driven. Actually, it's an equal partnership with the three of us in relation to that and the prison service, which is really key in relation to that. I've mentioned before that we've got dedicated intelligence research and briefing officers who track people's offending who are in the cohort. those that don't want to engage within the cohort, and equally importantly, as we've seen in those stats, those that have been deregistered in terms of their engagement, and if they've slipped or indicating that they're going back towards criminality, that we can pick those up as well. We've written into the policy about the youth teams to refer cases as people transition from older children into adulthood, to make sure that again we're able to tackle that before they go into an adult life, to make sure that they've got the support, and again improve where we are with that, because I think that transition from child into adulthood, 18 into 25, depending where they've come from, is a really key important area, especially when we look at the demographics of where some of our offenders sit within those age cohorts as well. And I think I've touched on before about the looking where we are about nationally, and in terms of the new strategy that's come out in relation to it.
So just quickly on links with prisons. I mean, that is particularly challenging for North Yorkshire, because our offender cohort is spread across quite a large number of prisons, whereas in West Yorkshire or the North East, they've got prisons in their localities. We don't, and that's always presented as with a real issue around effective communications around release, and making sure that people are released into appropriate accommodation with support and all of the rest of it. How is that situation at the moment? Is it getting any better? Is it still the same? What can we do? We've got quite a lot of work going on at a regional level around all of this. How do we feed that into all of that regional work?
You're right. The fact we don't have a prison other than Askham Grange within North Yorkshire does present as a challenge, but it's not a challenge that we've shied away from, and in fact we've tackled it, because people being released from prison is a great opportunity for their intervention. People are looking for support, and some of the pathways that we've got for complement that prison release in relation to that. So we have been engaging with prisons, and the work that we've done around matak has opened some of those doorways in terms of that, and that's going to be covered in the latter part of the presentation, if that's okay, in terms of the engagement that we've had with prisons and the successes that we've seen with that as well, if that's okay. If I can just delay that for 10-15 minutes, if that would be okay.
Yep, no problem.
Okay, so I think in terms of the work that Trinity has delivered is probably well explained within the next slide, which is a case 107. It's just a reference number in relation to our tracking processes that we have in place, and because I think examples of where we've then explained successes are really key to be able to get some of the messages across in relation to them. So this is the case of an individual that wasn't listed, wasn't working with any of the statutory agencies, but was referred into Trinity. They had an extended, long history of high risk domestic abuse. There were orders in place against the individual who was in prison. At around about their time of release, they expressed the view that they preferred prison. It's a known, recognised routine that they were comfortable with, and it wasn't necessarily the deterrent that some people would see prison to be, for lots of reasons. In terms of background, this person that we were working with had a history of mental health around anxiety and depression, which was linked to drug use. And through Trinity, following that referral, we were able to get that individual into a treatment to break away from the negative influences that they've had from some of their peers, secured some accommodation for them, and through that and that stability was then able to develop their own arrangements around getting and owning into a property in relation to that, because their financial situation had improved, which was one of the pathways that we linked to earlier on today. Okay. What we also saw was that through the drug intervention work and support, Since their adoption into Trinity, they've stopped using Class A drugs, which is a significant element to that in terms of those risks and the drivers for crime, and successfully became to be deregistered from Trinity, not deregistered because of criminality, but deregistered because of the successes that they had in terms of the pathways, the reduction of crime in relation to that. And since that person has come out of the scheme, there's been no further arrests. There's been no intelligence about any further criminality, and that person is now thriving, supported still by doctors in terms of mental health, but actually without the intervention of any illegal drugs as well. So for somebody that had scored really highly on adoption, is much lower and has now gone on to live a independent life in terms of that, without crime impacting on them, which is really positive in relation to that. Okay, so if we move on to the second part of the presentation, which is looking at matak, if we can, please. Okay, so matak, that actually stands for the Multi-Agency Tasking and Coordination, which is an initiative that we introduced into North Yorkshire following our regional joint working with Northumbria and the other forces around supporting women and girls victims of domestic abuse. So if we look at the roles and the functions of the matak team in relation to that. So
sorry, Alan, I think it's just we need to say that this is a perpetrator program, isn't it? So yeah, just for clarity.
My apologies. There's probably, and we'll come to it later on one of the other slides. There are two elements to matak and marak. They are different. Marak is the multi-agency around victims predominantly. Matak is the multi-agency element to around perpetrators. So you're right, Commissioner, my error in relation to that. But it is a programme and a scheme identified and used to coordinate our response to support the perpetrators of domestic abuse. And those serial perpetrators. So it's not necessarily that one-off incident. It's those offenders that are continuing that cycle of domestic abuse against victim or victims, and they commit and cause the most harm in relation to that. The way that it works, we introduced this in November 2019, and since 2019, we've secured the sustained funding through the precept to make sure that these posts are being made permanent, and that's on the basis of the successful work that we've seen the matak team complete since its introduction in 2019. So the way that it works, in essence, is the matak team, which is made up of a coordinator and an intelligence officer, will look at the recency, frequency, and gravity, and the victims that a person and an offender has. And that comes out with a score, and that score will show whether or not they meet the threshold for adoption onto the scheme or not in relation to that. And we will then have that intervention with them to see if they would like our support to stop them committing further offences, to reduce the harm that they are causing. And that results in one or two pathways for them. A green route, which is that they want to engage with us and our partners to reduce the harm that they're causing, or red route, where if they don't, we will go down the disruption and engagement route to deter them in that positive way in relation to it. Obviously, our preferred route is the green route, because that reduces victim harm, which is what we're wanting to achieve in relation to that. The matak team have also developed around stalking profiles, chronologies around stalkers as well, because we do know that there's a correlation between domestic incidents and stalking, either during the relationship or when the relationship has come to an end. So we've had that engagement and development within that role as well. That links into our stalking team. So if we just look at the next slide and sort of the size of the cohort that the matak team have been dealing with since its initial adoption, development of the pathways and where we are, they've adopted over 125 nominals, individuals into the scheme. In terms of that 125, we are still working with 24 individuals who are discussed on a monthly basis around their offending and the targeting of them. Okay. I think the key part to this of the original 125 from when this presentation was put together, 101 have been archived, and 70% of those had a lower or no change in the score. Okay, and through that, 40% of them have not had any further domestic abuse incidents. So when we translate that in terms of victims and victim harm, that is important, because that's reducing the number of incidents that have taken place, the number of victims, and also the demands on the policing in relation to that, and obviously investigation.
Alan, sorry, just on so I'm sorry, but that means 60% did go on to offend again, which is quite high. And do you know what that offending rate would have been had the matak not existed, if you see what I mean? So what is the improvement that you have gained through the matak?
Okay, so in terms of that, of that cohort, there's 40% who've not had anything at all. So these are our high risk offenders who have reached the threshold in terms of recency, frequency, and the gravity of those offenders. So our serial domestic abuse perpetrators. So of that large cohort, 40% have had nothing at all in relation to 6 months. So
yes, but what would they have done if they hadn't have been part of the matak? I know that's quite a difficult question to answer. Would have they just continued with their offending behaviour? You see what I mean? Because sometimes things change in people's lives, don't they? And it changes their behaviour. I'm trying to understand the impact of this, you know, because it's a new service and we've just got a lot of money to support it, and we've put a lot of money into this service. I'm trying to sort of understand the impact of a new service.
I think if we hadn't have completed the work that we were completing with them, they would have gone on to commit further offences. And probably in terms of the serial perpetrators and those that are presenting the highest level of harm, that would have resulted in further victims. So we've stopped more victims coming to light. And the other side to it is when we look at the 70% who've had a lower or no change from being archived, again, that is another success in relation to that, because we've reduced their offending and the number of victims that they've had through explaining what is happening with them. Does that answer your question? I'm not sure if it does.
Well, I think it's probably the question is difficult to answer because there wasn't the benchmarking done before we started this programme, which is probably what I'm asking. But the 70% as well is a lower or no charge. So that could mean that 69% have had no change and only 1% has been lower. So and that would suggest it's not quite as effective as you're suggesting here. So I suppose it's just to sort of understand. I'm trying to understand the impact that this has had, because these are really difficult cohort of offenders to deal with. I understand that, and it's trying to understand that impact from a point where we had no service with dealing with these, or a limited service, not a focused service dealing with these perpetrators, to this specialist dedicated service.
Julia, it's Phil. Would it be okay just to pop in, because I think it might be useful for if Alan could explain in terms of what it takes for somebody to get into the risk levels, the high risk levels that he's talking about, and that actually that pattern of behaviour to get into a high risk category is one where we're seeing escalation in terms of either violence or frequency. So that would probably help to explain the positive element that Alan's saying around the no change part, because if people continue in the route that they're going in relation to this, then ultimately what we're talking about are domestic related homicides. So I think, Alan, it might be worthwhile just explaining to the public what the high risk category and what it takes to get into that.
That's really helpful. Thanks, Phil.
No, thank you in relation to that. So we talked about the recency, the frequency, the gravity. Okay, so domestic incidents can vary from a verbal argument where nobody's assaulted, all the way through to, as Mr. Kane explained, a domestic homicide, which we are trying to avoid. We do not want people dying in relation to domestic incidents or being seriously hurt. And so the offending that takes place, whether or not that's a Section 47 assault, a Section 39 assault, common assault, or grievous bodily harm, each of those receives a different score in relation to that. That score is then put into an algorithm and is multiplied by how often that takes place, in terms of, is it once a week, once a fortnight, once a month, because the frequency that those incidents take place obviously increase the risk that we're trying to manage and reduce in relation to that. And that will also be connected to some of the risk factors that we'll see in terms of age, alcohol, pregnancy with it as well, and the victim in relation to that. Is it one victim? Is it two victims? Is it a number of victims over a period of time? So all of those elements to it increase the score that we have. And Mr. Kane is right that actually what we're trying to reduce the score, either in terms of the nature of the incident that's taking place, from a physical assault to a verbal assault. In many respects is successful because somebody's not being harmed to the same level, but still we want to reduce that even further. And also the number of occasions that this is taking place as well in relation to that. And I think it is a difficult question to answer in terms of what would have taken place if we hadn't have done it. In relation to that, I think the fact that we've been able to reduce the scores and reduce the number of incidents of domestic abuse that have taken place in these high-risk offenders who are serial domestic abuse perpetrators, who are always committing these offences, is where that measure of success is in relation to delivering that through either the targeting or education and awareness about what they're doing and the impact of what they're doing as well, which is what we've seen in some of the intervention programs that we've been able to have.
Okay, so I'm now going to ask you about coercive control, because everything that you've talked about there is about physical violence, and actually a verbal issue can be just as serious as a physical assault if it's part of a coercive controlling behaviour pattern. So where does that fit into all of this?
So in terms of the nature of the offences and coercive and controlling, that would be would fit into that gravity in terms of that with where it is. In terms of coercive and controlling behaviour, it is an area that personally I'm keen to improve officers' awareness in terms of it, because I don't think it is something that is necessarily always understood or always recognised, and it is that's not just in North Yorkshire. I think it's a national challenge around domestic abuse. So what we've seen, or what other forces have seen, is where they've had training and development around domestic abuse, the recognition of coercive and controlling behaviour offences has also increased as well. So it's correlated to that. So through the work, through some of the work that your team have done in terms of the commissioning side, we've secured some government funding. And we are now in the implementation stage of some domestic abuse training that's going to be delivered across the force to people in the control room.
Is that domestic abuse matters, Alan, or is it something different?
It is the domestic abuse matters training which has been delivered. That's going across to 75% of the force. When I say 75%, there will be an obvious question of why aren't we doing it to 100% of the force? Okay, this is around delivering what we've got, improving knowledge, awareness and training, not just at the front line and those officers going out to incidents. It's from that first report into the control room, which is really critical in terms of understanding threat, harm and risk. It's about those officers that are attending. They're safer neighbourhood officers in terms of support, and also around the investigative side of it as well. So that's going across, and that starts in April this year. So what we should start to see as a consequence of that is an increased knowledge and awareness around coercive and controlling, which has been seen in so many other forces nationally as well. And we've been able to do that through the work through Sarah and her team. Okay, so that's starting, and that will pick that up
is really important, because you look at, I don't know, Luke and Ryan Hart's example, and that, you know, was not about physical violence, and that ended in their sister and wife being shot in a swimming pool car park in Lincolnshire. So, you know, it's not all about physical harm.
you're right, and in effect that subtle abuse without that physical element to it is sometimes victims will find that very hard to explain, and people who don't see it. These are domestic abuse injuries in another manner around psychological and that harm, and whether or not it's financial, sexual, control, psychological, and that's where we need to improve people's awareness around that, not just ourselves, but also with partners, our investigation, and for families and victims to understand it isn't all right to be verbally abused, and people should pick up the telephone and report it to it, and we can respond to it appropriately. Does that answer your question around the coercive control?
Well, I don't see it as verbal abuse actually, because it doesn't that makes it sound as if it's violent words, but it isn't. Very often it's much more insidious than that. Yes,
I agree entirely. Okay, so if we could just go to the next slide, we can have a look at some of the further figures that we've got. So when we talked about some of the successes of matak in terms of that, I think looking at those, that of the 125 that we spoke about, they are the percentages and successes that where we've seen in terms of those. I'm more than happy to answer any questions of those, because I think just the very numbers themselves speak for themselves, and if you're in agreement.
That's fine, Alan. Yeah, keep going.
Thank you. So if we go on to the next slide, we'll just put some demographics into the next slide, just to explain the age groups of the cohort that we've got within matak in terms of gender and ages, and in terms of that, which is key, because we do have female offenders, domestic abuse offenders within our domestic abuse cohort, and we work with both in terms of that to reduce the impact that they're having. If we look at the next slide, which is a further breakdown, which is around our female cohort of domestic abuse matak nominals, we can see from that which ones have engaged within the green routes as well.
It's good to see referrals into the Women's Centre there, so thank you.
And the solutions to this, Commissioner, they aren't one-dimensional. It's trying to find the suitable pathways for an individual in terms of they're all offending. So there's lots of different reasons for why people commit crime, and it's trying to identify those and address those in terms of actually having that problem-solving approach to it in terms of where we are. Just moving on to the strength slide, we've support the matak team have completed over 30 referrals into the DA perpetrator scheme in the last year, with in respect of drug and alcohol perpetrator programs, housing in terms of that. What we've also done around prevention and early intervention is supported Clare's Law's disclosures, which is increased demand-wise during COVID. Clare's Law's disclosures, where we will either believe that a victim has the right to know that the person that they are with presents a risk of domestic abuse, and we will proactively go and make a disclosure to them, or people can make a request of, does this person present a risk to me in terms of that, and we support those, and we have seen the numbers of those go up. It's a proactive approach that we take across the domestic abuse team, so that people can make informed decisions about the risks that they face in terms of the relationship they are in. If we continue to have a look at the next slide in relation to strengths, and I'm just conscious of time, that does touch on, Commissioner, around the work that has been taking place across the region in relation to prisons, in terms of information share agreements, which were initially with Hull, prison and how they've been extended across into other prisons across the region, which is really important in terms of where our prisoners would go to in relation to that. And the positive approach and interventions that have been taking place around phones, access to victims who may be subject of any orders, such as restraining orders, to make sure that whilst the perpetrator is in prison, the victims are still protected and out the reach in terms of that contact from them. And that's been extended to a number of prisons within the region. Do you have any questions in relation to that, or is that slide?
No, I'm just conscious of time, Alan, like you as well. I've asked too many questions.
Okay, so in terms of delivery of letters, we're working with custody suites to explain what matak is to our domestic abuse perpetrators. That has actually resulted in some of our offenders picking up the phone and asking for help, which is really important in terms of being able to do that. And that's where we want people to identify that there's an issue, and if they can self-help and work with us, that again is a lot better in terms of picking that up. And we will work with people who want that help and are willing to engage, because that's really key.
Okay, thank you.
Done that. So aims and results in terms of what we're trying to achieve as we move forward. We obviously want the further reduction of domestic abuse, and which is where we're working to develop, and our continued engagement with other agencies to support people around matak. And then the very last slide in this presentation, Commissioner, is in relation to just a case study where we supported a perpetrator who'd had 20 years of offending. That individual phoned the matak coordinator directly in relation to that. Took up offers of support around the domestic abuse perpetrator scheme that you're aware of, and since their engagement has actually been archived, we've had no further incidents for that since that adoption up until their reassessment, regrading, and now they've left. And obviously we'll continue to be form part of that cohort and will be monitored.
Thank you. I'm extremely supportive of the work that's being done around all of this, and I know it is making a difference. So thank you to your teams and to people who are working really hard on this, dealing with some really difficult issues. So thank you very much. And whilst we can always do better, I think we have made progress. I still remain to be convinced a little bit about Trinity, but we will continue on that journey, I'm sure. So thank you very much.
Thank you.
Annette, are we looking to you now?
Yes, we are. I'm just about to share my screen. So if you can just confirm when it comes up that you can see that.
That looks great.
You've got that. Right. OK. Right. Thank you very much. And I am aware that there were a number of questions, which hopefully I will be able to answer throughout the this performance update. So just to confirm, this is for the month of December, and the first slide relates to mental health incidents. In particular, there was a question in relation to what appears to be and what was a decrease in mental health incidents from this slide. If I can just point out too, the time period around May of this year, you will see that there was an increase overall, that throughout the year there was a peak in July, and it's decreased slightly over time. At that time, we introduced a update in our IT capability within our control room, which meant that lots of incidents such as mental health, domestic abuse, we introduced auto tagging, which was a more developed, sophisticated way of identifying these incidents that didn't rely solely on manual input. So the communication officers and others to do that. So the lots of the increase was as a result of this auto tagging, which actually would give us better, more accurate reporting, and that in particular was based on keywords associated either with mental health, domestic abuse. So we anticipated that this would see an increase. From that time, round about the last couple of months, we've done some sort of further adjustments in relation to that. But what we are confident about is that actually this gives us more accurate and better reporting and recording. So that then gives us more meaningful information about the extent of mental health incidents. We've also done some dip sampling in relation to that as well, to make sure that that accuracy is correct and reflecting the mental health incidents. I think the question, though, was particularly in relation to the increases because of COVID related, because we absolutely anticipated both, locally within North Yorkshire and nationally, that there would be an increase with mental health incidents. So throughout this time, what we have been conscious about is trying to understand the impacts or those incidents that are COVID related. So each incident does get assessed both within the control room and then an appropriate response based on that. And also it's been sort of quite difficult to predict some of the changes and the impact on mental health because of COVID, the impact of different tiers that we've had, in particular in December. So there's a range of factors there that has meant that there's been a natural increase anyway because of our recording, but also because of some of the COVID impact. What we do have, and you're well aware, Commissioner, around this is that we've got a really well-developed partnership approach around our response to mental health incidents. So both in the police, we've got a very good vulnerability assessment in relation to that. And we have health professionals within our control room as well to help us respond and assess those incidents. Through to our strategic response. So in terms of the mental health, although there was a decrease within there, it isn't something that we could say it was as a matter of underreporting in December. Is there anything you want to ask about that? I just want to make sure that really specific about the response that question.
Okay, so Annette, I think I sort of share their concerns, and if it's all right, I'd like to ask Tom to pick this up as an action to look at this in more detail to get more assurance around this, particularly around the sort of auto tagging thing. Yeah. I think the other thing for me that is, I don't know if it's you can draw any conclusions from this or not, Annette, but the number of people presenting and taken to health-based places of safety from custody increased during the lockdown period. And it seems to be, and I don't know what's happened subsequent to that, but we've also obviously had an issue with some of our street triage teams as well, and choose resourcing those. So there are a number of factors here that I think probably warrant a further look at this area of business. Yeah. So if it's okay, I'd like Tom to pick that up and take that out of this meeting and to have a bit of an assurance look at it, if it's all right.
Yeah, very, very happy to do that. Tom's aware this is also being discussed at what we have in an operations board. So we really have had, sort of in-depth discussions, but I'll take that out with Tom and then be able to give us further update at the next Pam.
Yeah, that'd be really interesting. We'll have a bit more data by then as well, which I think will be interesting, because my worry is that without the street triage teams, and some of those support mechanisms, because we know NHS partners in particular are so stretched at the moment that we're starting to see an impact of that, and I want to understand that. Okay,
right. Okay, thanks. So just moving to the second slide, we also saw a real decrease in section 136's too in December. Again, an area where we probably over the sort of Christmas and New Year period would see sort of greater numbers than that. But the numbers remained significantly lower than normally what we would expect. And again, there's lots of factors that could, kind of account for that, again, which I'll take out with Tom. The mode of transport, so there wasn't any taken out of North Yorkshire area, and also on the whole, in terms of the transport, the ambulance conveyed them to that place of safety.
Okay, and so there's some odd stuff going on here, isn't there? And I think we need to just interrogate it a little bit. Tom, you want to come in?
Yeah, well, it's maybe something we can pick up outside. I just wanted to note the probable coincidence that we have 8 being returned to the community and 3 admitted, and we have 8 being taken to York and 3 being taken to Scarborough. So I just wanted to ask Annette, do you know how those figures correlate? I'm sure it isn't a straight match, but if it is, then do we understand a bit more about why that is? But we can pick that up outside.
We can pick this up, and doing it just looking at month by month doesn't give you that full picture. Yeah. We've done that more recently, where we have to take it over a longer period. But yes, we'll discuss that a little bit further.
I also want to just try and feed this, if relevant, into the Crisis Care Concordat Board as well. So because we do know, this isn't just a policing issue. This is we work with, key partners in this area, and we know those partners are under pressure at the minute. Yeah. So I just, for obvious reasons. But if it is starting to impact on it, we need to be cited on that, and so this could be early data that's suggesting of that. So let's take it further.
Okay, so moving on to incidents. Again, throughout December, a period we would normally see increases both in incidents and crimes. What we had is a reduction of around about 4%. So that was around about 250-300 incident volumes. And so again, I think this is very much terms of the restrictions and tiered approach and changes in behaviour and people's lifestyle throughout COVID. So again, it's very different to what we would normally see and expect. In terms of crime overall, we've still seen the significant decreases that we saw right from the beginning of the pandemic. There's no particular area that we've seen significant increases. We have had, we've discussed this before, still around public order offences. Some possession of cannabis. There have been increases in particular areas around proactive policing. So there's been those type of changes, but on the whole, we've seen those significant reductions throughout the year.
I think we're going to have to just remove 2020 and 21 from all statistics in the future.
Absolutely, and not knowing what's happening in 2021 as well. Yeah. But I think, and I've spoken about this before, about the assurance in our response to very quick changes with the tiers, with the different restrictions. We've worked on the whole really well with ourselves and our partners in response to any of those changes. It has been unprecedented, of course. So that just gives a snapshot of the over overall crime itself.
Sorry, and then to go back to that slide, because the one that really stands out for me here is drugs on the one by district. So there's big differences. So in drug offences. So you know, in Selby, a 23.48% increase versus a decrease in Hambleton and Richmond. Now that will be related to the proactive work that you've been doing, but it's really, that is really interesting, the variety across the patch, and we know that you know, we've got all of the issues with county lines and all of the rest of it. So it's trying to sort of understand what's going on there as well.
Yeah, and again, that's it. You know, sort of we're really mindful about, you know, sort of the difference making, sure that, you know, we still keep our foot on the ball in relation to the sort of the and our proactivity up and being proactive around the drugs. But again, there's more that we can do to understand that. I'm just conscious about the time, Julia. So yeah. If I can just go back into exception report, and of course this is all available on the website, but mainly in particular to there was a question in relation to antisocial behaviour and the increases with that, but also whether that would include elements of domestic abuse. And it's just to give that reassurance that that domestic abuse and incidents would be recorded differently, wouldn't be recorded in any way such as antisocial behaviour. There has been which we know, significant increase, and we've also included those tags again around COVID related, and as we can see across the board there, that there is a vast amount that has been associated with COVID-19. Again, just to give reassurance to the public, that our local neighbourhood teams as well do review all the antisocial behaviour incidents, looking for any patterns. Of course, when it first comes in, again, it's assessed whether it needs a response to it, but then all of the antisocial behaviours are then reviewed and followed up with the local neighbourhood policing teams. But again, in terms of that particular answer around would that include domestic abuse, it wouldn't.
No, and so that's absolutely, it wouldn't. But I do think there is an issue with antisocial behaviour and confusion between the statistics about what would be quote unquote normal antisocial behaviour and what is COVID related, and that these stats don't help that. No. But I do also think that there are some issues, and you know, in particular, we've got, for example, the community really quite concerned in Ripon at the moment around ASB. We've had it in other areas, and I think this is something that we just do need to just really keep an eye on. I noticed that the Chief and Dep want to come in. Lisa, do you want to come in first?
Thank you, Julia. And then I may regret saying that if Phil's got something more wise or eloquent to say than I have. But I think the other aspect of this that's really interesting for us and absolutely would welcome us getting a much more in-depth look at this is the police definitions of antisocial behaviour versus crime are set around recognised definitions in terms of crime recording standards and what is assessed as an antisocial behaviour incident and the different categories of that. If I was a member of the public thinking about antisocial behaviour, to me, all crime is antisocial in its very nature. So where we might see fluctuations in antisocial behaviour versus crime because something that goes beyond antisocial behaviour is then a recorded crime and they're shown separately, the public may think actually that crime is antisocial behaviour to them, and it's put in the context around that so that we understand the separation of the figures between crime and antisocial behaviour from a policing definition perspective versus how it feels to live in that community, and that crime might feel very antisocial, but it will only be recorded by us as one or the other. So I do think it's worth a closer look at this and from a public perspective of how does it feel to live here in terms of how their area feels.
Thanks. Phil?
Yeah, and nothing more eloquent, by the way, so I can't live up to that one. I think, Commissioner, the other bit for me is I think this goes back to what is well versed in terms of the broken windows syndrome for us, in that actually we have to record those, for example, criminal damage of a broken window has to be recorded as criminal damage. But like the Chief says, it linked to that, it is antisocial behaviour to the members of the community that are suffering that or seeing that. So again, if you are walking down your street and seeing a bus stop continually smashed up, or a window broken in a derelict building, those sorts of things, then yes, they are recorded as crimes, as criminal damage, but they are antisocial in terms of their nature. I think the challenge for us that the Chief rightly lays down is how do we take account of that in terms of our problem-solving planning with our neighbourhood teams, but also how do we take account of how the community are feeling in relation to those types of crimes, cross-reference with what we would traditionally record as antisocial behaviour. And I think that's a proper challenge for us to try and take on and have a look at.
Okay, thanks, Phil. I do also think it's really important to look at these figures on these slides carefully, because if you look at Scarborough, for example, under the ASB stats, which has seen a 50.63% of the 6,792 incidents, 6,399 are COVID related. So it's really important to understand the impact that this is having around those figures, and that isn't because there are lots of people out on the streets committing antisocial behaviour. It's because of the way that the incidents around COVID enforcement are being recorded, and I think it's really important that people understand that difference. Tom, you want to come in?
Yeah, sorry, Julia, can I just come back on that point? Because
yeah.
I think it's absolutely valid in terms of what you're saying, because whilst you look at the volume of COVID related incidents there, something pre-COVID where a group of young people, for example, in the corner or in the park would not have been recorded as an antisocial issue, it is a breach of COVID regulations, and therefore we are recording it as antisocial as a result of that. So I think that's why it's really hard to differentiate between the two.
Exactly. So we're not, because this would suggest that we're seeing a massive increase in antisocial behaviour across North Yorkshire, but that's not the point. There are areas where we are seeing some issues, but we're not seeing a sort of pandemic of antisocial behaviour, if you like.
I think we also have to put this in the context. So obviously we started having discussions around this last year when we saw massive reductions in antisocial behaviour. So we've gone from quite a high base to then, for various different reasons, including, as has been referenced, the better recording of crime rather than as antisocial behaviour, to having very low levels of recorded antisocial behaviour. And then in the context of the COVID situation, we've gone skyrocketing. It looks like we've gone skyrocketing back up. But we did have those conversations last year about why we were seeing such reductions in antisocial behaviour when it didn't necessarily seem that way to the public, and we were still getting the public talking about perceptions, as you say, Lisa, of high levels of antisocial behaviour. And I think there is just still that concern, as we've kind of referenced here, around, are we, because we're recording these as specific crimes, are we looking at them therefore as specific instance and missing a wider picture about what might be happening in communities that affects the way that they are feeling and how safe they are feeling in their community? And I do think that we still need to find some way of recording properly, but being able to monitor and see how because quite often it will be reported as antisocial behaviour, but we will record it properly in a different way, or else we will be able to determine that it is kind of as a result of what we might class as antisocial behaviour. So I think we do need to find a way to maybe reflect that somehow in the way that we're recording our crime going forwards. But we can continue those discussions outside of this meeting.
Yeah, and I know Annette's valiant attempt to keep us on track. And we've completely messed it up now. So let's go to the control room if we could. Thanks.
Yeah, and this was another question from a member of the public that unfortunately had to wait for over 30 minutes to get through to our 101. number, and really apologise to her that was the case. However, having had sort of various updates throughout the year, and unfortunately deteriorating position, it is actually improving now that we are getting the right number of staff that we've recruited in there, so they are still learning. In January, we should almost be fully up to establishment, so it's certainly been an improving picture. What we can see both within sort of the 999 calls in particular, that we now sort of stabilising in relation to the speed of answer from where we were in September, October. So certainly that's been improving as percentage answering, but I do want to get to the 101 calls. So in November and certainly December, so we are looking at the average speed of answer here, so the purple line. We are seeing improvements that we had in back in 2018. So the average answer time was just two minutes and 2 seconds in December. So that has really improved. Although I do say average, 50% of those are answered within under 5 minutes. But unfortunately, there are times where callers, members of the public, still have to wait too long, particularly in busy periods. As you can imagine, we do get those peak periods, particularly Friday, Saturday nights. And although we try and again resource that to meet the demand, sometimes that is still a bit of a challenge. However, that certainly has improved. Along with that, so has our abandonment rate, so that has kind of reduced, and it's just a reminder to the public that we do have a callback facility. So if they don't want to wait, they can leave their details and they will receive a callback for that. And also over the coming months, we will have the ability, or the public will have the ability to report crimes online as well. So there will be different ways of being able to report if they wish, which gives them a different option. So again, we are really, confident that actually we are stabilising performance. There was a period at the end of December where a number of staff had to self-isolate, which will show a little bit of a sort of a next month, maybe a reduction, but that was directly COVID related. So it is an improvement picture. We are more confident about the stability of that. But we have still got a lot of new people in there that's still learning, which again has reflected in the average call duration.
Okay, thanks. So in summary then, we've recruited a lot of people, they're getting up to speed. We had quite a significant issue with COVID around self-isolation, when I think over 30 people had to self-isolate, so that's quite a significant number. That's now back, and we do, I think, ask the public to bear with us a little bit during COVID when something like that does happen, because that is outside of our control. And once the new trainees really get up to speed, we should start to see some improvements come through. Yeah. Tom.
Just for clarity, Julia, slight slip of the tongue there by net. It's 50% in under 5 seconds, not in under 5 minutes. So just want to clarify that, and also just to say, because I've been in touch with the FCR recently on some of this. The gentleman who unfortunately had to wait 30 minutes is part of only 2.5% of calls that took over 15 minutes to answer. So
I don't think that will help the gentleman.
I'm sure it won't, but I hope it illustrates that it's not the norm. It's the exception rather than the norm.
But when you are the person who has to wait 30 minutes, that doesn't feel great. So okay, fantastic. We've eaten into fire's time now in a significant way, so I apologise to the fire service in advance. and thank police colleagues for all of those interesting and thorough presentations. So thank you very much. Okay. Andrew, are we to you first or Jonathan?
Straight to John. I think John can introduce the next subject much better than I could.
Thank you, John.
Thank you, Andrew. Thank you, Commissioner. Again, welcome to the people that are observing this presentation. And so what we're going to be talking about this month is fire control and response. And so this is a little bit more in detail now about our call handling procedures, how we go about monitoring that, how we go about monitoring how long it takes from point of call coming through into the service to actually getting appliances on the scene, and how we aim to go about improving that, and how we aim to look after all areas of the service through that monitoring process.
Okay, John, so just before you get into the detail of that, I just wanted to cover a little bit one of the other questions that was asked, and I'm sure we'll unpick that as we go along. But we don't have specific response targets in North Yorkshire, partly because of the nature of our geography makes that really challenging. And so what we try and do is understand whether people are getting the right service or not, and the outcomes for that. So I just wanted to sort of say that up front, really. Tom, did you want to say something?
Julia, really just I would reiterate what you say there. Obviously, the geography is very complicated, and we know we're working closely with the services, looking very closely at the way in which they map the kind of time that it takes to get, and also where a lot of the prevention and protection work is focused, which I think will be covered partly by the presentation. So we can always come back to that maybe at the end. If there's anything else.
I mean, it's much simpler to put a response target in the middle of York than it is in the Dales. And therein lies the challenge.
And it doesn't actually describe the service that the fire service provides to members of the public, and it's an arbitrary measure which doesn't actually reflect the quality that we're providing out to members of the public. I think is the point. Okay.
Sorry, John, I just thought we should caveat that to start off with. If you want to crack on, apologies.
No problem. No, that's fine. Thank you. And actually, it helps frame a little bit of what I'm going to talk about here, because what I'd like to do really is just explain a little bit about the journey, the history, where we are now, where we want to be in the future. So just a little bit of a history lesson here. The 1947 Fire Services Act did have in place a set of response standards, and here they are. We used to have A, B, C and D risk with the various response standards that had to be achieved at that time. And for a number of reasons of what we just explained a little bit there, in various different services up and down the country, it was not necessarily fit for purpose. And so when the change in legislation came along in 2004 with the introduction of the new Fire Services Act, those old response standards were actually removed at that time. But just to give you an indication of where we were in North Yorkshire at that time, there was no A risk in North Yorkshire, and this is talking about the risk as in the population, the buildings, etc. And all of these times were related to fire only. They didn't cover any other types of incidents at that time. But we did have B risk, and that was generally Scarborough and York and some parts of Harrogate. Hence, we had two pumps at each of those stations. And then the C risk tended to be the day crew stations, and D tended to be the on-call stations, as we now call it, the retain stations back then. Next slide, please. So along with the new Fire Services Act in 2004, we then got the National Framework Document, and that's been refreshed over the years. 2018, it was refreshed again. And what that did, it placed more of a responsibility on individual fire and rescue services to analyse their risk and to resource it accordingly. And so that put more of an emphasis on, having a look and see where our high-risk business premises were, for example, where our other types of risk were. So it included in there this time road traffic collision and other emergencies, whereas previously that wasn't focused really. And then demanded that we resource ourselves accordingly and that we refresh those plans each year. And that led to the introduction of integrated risk management plans. The current integrated risk management plan is due for renewal this year. We are now reviewing all of our risk in North Yorkshire, and that will hopefully then lead to a more detailed analysis of how we resource North Yorkshire overall, and then look forwards to how we might best place our available resources to meet the demand of that risk. So it's been quite, the current IRMP does not have a response standard attached to it, as in a specific time. And that was largely around the response to the overall geographical area of North Yorkshire. I'll talk a little bit more about duty systems in a minute, because that very much influences the difference and the speed and weight of attack that we can send to emergency incidents. But nonetheless, it's something that we are focused on, and we will put measures in place to provide more of a targeted approach going forward. So the current IRMP is due to expire this year. It was set in place 4 years ago. So we are now reviewing that. But one thing that we have implemented, next slide, please, is a service strategy. Now, the service strategy covers 4 directorates. So that is service delivery, that's the frontline service capability that we've got. It covers capabilities, so that's all the equipment, the policy, procedure, the personal protective equipment, all of that side of things. And then we've got assurance, which effectively ensures that we're keeping ourselves assured that we are providing the best service to the public, make sure that we are legal and compliant and fit for purpose. And then there is enabling services, which is all the support functions, and that very closely aligns with the police with the collaboration agreement. So under the new service strategy there, you'll notice that we've got a strategic aim, and it talks there about the most appropriate emergency intervention to the service within the quickest time. And then the third bullet point down there again talks about how we will aim to mobilise our resources to respond to emergencies with the correct strength, speed, yet safely at all times. And that's really important to set. So the strength side of things, we have predetermined attendances for all incident categories. So if it's a person's reported a life risk, we will send at least 2 fire engines to it. If it's a road traffic collision, again, minimum 2 fire engines. If it's on a motorway, we'll send 3, 2 on the affected appliance, 1 on the unaffected carriageway, so that we've got a dual response. And that applies to all the incident types we've got. So that's the strength of our attack to all incidents. And the speed, we'll talk later on about the speed side of things, because we have a drive to arrive policy within North Yorkshire, and that very much links safely into the safely part, because it's not just all about full on speed to drive to incidents, it's about getting there and getting there safely as well as. So the service strategies have been introduced this year, and the reason we not at the moment got a set arbitrary response standard is down to our duty systems. So we have shift stations where we have an immediate response. So the shift stations that we've got, they are crewed 24 hours a day, 7 days a week, 365 days a year. So they always accrue at those stations for immediate response. And then we've got day crewed stations whereby the crews are.
John, I think so. Just say where we've got the shift stations, that would be an example of that would be York, wouldn't it?
It would. Sorry.
Yeah.
So we've got 3 stations in York, Huntington and Acomb, which are all shift stations, Harrogate and Scarborough. So 7 in total, and they are immediate response, and that's largely reflective of the area, the risk within those towns and City of York as well. The day crewed stations, these are stations where during the day we've got crews available at the fire station from 8 o'clock in the morning till 6 o'clock at night. And again, during that time, they are available for immediate response. But then at night time, from 6 o'clock at night till 8 o'clock in the morning, they go into what we term as retained mode. So they are on call from their home addresses. Now, the difference between the two, it means that one is immediately available during the daytime when it's day crewed, but then at night time they have to respond from home. That puts a delay on their immediate response. And then similarly with the on-call stations that we've got, we have got a large proportion of the on-call stations. The majority of our stations in North Yorkshire are on-call, and they are all, so there's nobody on those stations during the day. There is always a delay so that people are either at their home address or will be in primary employment going around their other business, and they've got to respond to the fire station when their pager activates. That again puts some sort of a delay on. So if we had an overall average and we set that we put a target in there that we wanted all appliances to respond and arrive at the scene of an incident within a set arbitrary time, then the shift stations would generally hit that target most of the time or all of the time. The day crews would hit sometimes during the day, but not necessarily at night. And the on-call stations would rarely hit it. So that's why we don't have a set arbitrary response standard. Now, there are different ways of doing this. We could set 3 different standards, similar to what the old ones were. But we're going to talk a little bit further on down about the opportunities, because we see that this fits more closely now with individual stations when we look at their profiles. But, you know, the commitment is that we will always mobilise the correct amount of resources with the correct strength and the right speed at all times. So we'll always aim to be there as quickly, as safely as possible. And of course, we will always be looking at data to steer us where we can change things to improve on that along the way. It's something that's been noted within the HMIC FRS inspection report, and so it is something that we are working on to try and improve for the future. Okay, next slide, please. So what we're going to do now is have a look a little bit closer about how we monitor our response times and how we look at each individual aspect of that. So the overall response time, just to give a definition, and this is a Home Office definition that we report upon, the overall response time, the total response time, is from the point of receiving a 999 emergency call to dealing with that and actually having appliances, fire engines on the scene, and that is the overall response time. So it's from point of initial call to the first appliance arriving at the scene. And that's broken down really in terms of monitoring purposes into 3 areas. Call handling, which is the time from the call to actually that the control operators take to handle the call and then actually mobilize the appliances at the station. We call it the bells going down. That's when the sirens go off at the station to say there's an incident. So that period of time we monitor, and we'll talk shortly a little bit more in detail about that. And then the next part is the crew turnout. So based on the different duty systems that I've just explained, obviously for a shift station, that's relatively quick. You know, that whatever they're going about their duties at that time, it's the time it takes them to book mobile and get going. For the on-call, for the day crew, if it's in the evening, that takes time for them to get from their home addresses into the station. That takes a little bit more time. But nonetheless, that overall, it's from the being alerted that there is an incident to actually getting at the fire station and booking mobile on the fire engine. And then the drive time is the part where they've booked a mobile on the fire engine, and then to them get into the incident itself. So it's from the first vehicle to leave the station to the first vehicle to arrive at the incident. And it's a point worth noticing there, it's not necessarily always the same vehicle. What that means is if you've got 2 fire engines from different stations mobilised to the same incident, it may be in one fire station's incident ground, but the other one, because of the duty system, they're mobile a lot quicker, but the other one would still get there first. So
John, just I think it's worthwhile just pointing out that if it's an on-call station, then the firefighters need to live or work within 5 minutes of the station, don't they? So they're not going to be travelling in for 20 minutes to get to a call. They're going to be there or thereabouts.
Absolutely, yeah. We're going to cover that in the next slide, but yeah, very important point actually. And there's a lot of nuances around that which can create problems, delays in getting in. But I'll if we put the next slide up, Tom, did you want to come in?
John, it was just to say, similar to Julia, I guess question, you talked about the kind of severity of the different incidents that you might respond to as well. Assuming that call handlers will maybe, if it sounds like it's a much more serious incident, call handlers might try and alert the station quicker. Would there be some flux in the different elements and the way that you respond in terms of the severity of the incident as well?
So in terms of the responding, which is the drive time to the incident, yes, very much so. We've got a policy which has 3 parts to that. Again, it's a slide further on in the presentation, but I will very much explain the detail about that and how we cover those 3 elements of that.
That's fine. We'll come back to it then. Yeah.
Okay. So this slide here, quite a lot of information on here. The 3 pillars on the left-hand side. This is monitoring. This is Home Office statistics. So we provide information to the Home Office. So the far left column was what our response times were in 2009 and 10, and the right-hand column is now 2019-20. That's the most current year. And then in between there, we've got the overall 10-year average. And what this is actually telling us, the different colouring layers in there. So the blue at the bottom is the call handling. The centre section, the orange, is the crew turnout, and the green at the top is the drive time from the station to the incident. And actually, over the 10-year period, on average, we now take 6 seconds longer to actually deal with the call handling. We've reduced our crew turnout time by 13 seconds, but the drive times have actually increased by 44 seconds. And overall, our response to incidents has actually increased by 36 seconds over the last 10 years on average. Now, there's a range of reasons behind that, but that's what that slide's telling us, that actually we have, it takes longer now to deal with these issues than it did 10 years ago. It's reflective really nationally as well. So, we're not alone in this. That is generally the reflective picture overall. And again, there are a number of reasons for this. So I'm going to hand over to Helen Cullen now, who is a watch manager within our control environment. And Helen's going to really focus on this slide about the call handling aspects and talk a little bit more about why it may be that we are now taking 6 seconds longer to handle calls, and how we go about monitoring that. So I'll hand over to Helen, who will come in.
Okay, thanks, John. So yeah, I'm just going to focus on call handling and some of the delays and factors that can be looked at as to increasing the call handling times. Over the past few years in North Yorkshire Control Room, we have had quite a high volume of new staff. This has often meant that we've got staff continually in development. So obviously, whilst we've got staff in development, it can increase call handling time slightly whilst they're going through their training period. Also recently, over the past couple of years, what we've introduced is some secondary questions to our call handling screen. These are a set of questions that we've added into our normal mobilising questions that we ask callers. These help us to identify and influence the predetermined attendance of appliances going to incidents. So this, for example, could be for a high-rise building. We've added extra questions in there to enable us to get more accurate information, to get the right resources out to the incidents. And we also ask secondary questions as well when we do have certain appliances on there, like our TRV appliances or our LRP appliances. This is to ensure that the system can calculate the right attendance and we get the right number of resources to incidents. Another factor that we found that can increase call handling times is...
Sorry, Helen, just in terms of LRP, just to that's light rescue pumps, isn't it?
Yes, yeah.
So they're slightly smaller fire engine, but still got all the capability of a normal.
Yeah.
Just want
we have risk information for certain addresses. This basically, once an address is input into the call handling screen, if there is risk information for that certain address, it does flag up a separate screen to the call taker. The call taker will then obviously read the information and add extra resources or inform other agencies that need to be involved for particular addresses. So again, this is something that we found can add a slight delay on the calls. What 3 words? Obviously, this is used by all control rooms now. We don't use it as regularly, but we're finding that more members of the public are using what 3 words and giving us that information on calls when they're not familiar with the location. When we are given that information, the call operator needs to open the application on a smartphone or a web browser, input the information from the member of the public, and then transfer this information onto the call handling screen. But what we found is that by adding the second questions in and by using what 3 words, it can delay the call handling, but it can reduce the drive time for the oncoming appliances because we get a more accurate location of where the incident actually is. We also use what we call advanced mobile caller location, and this is which is where a mobile phone sends us the information of where a caller is. It works on a GPS signal, so we get a call from a member of the public, and on our mapping system, we get a very, very accurate location of where they are. We have a circle around their location. It does only work where there is a GPS signal, so sometimes we have to question callers quite a lot, with us being predominantly rural in North Yorkshire. And what we found here is we get a lot of tourists into the county. We get a lot of people travelling through the county who aren't aware of the location. And this is where we rely on our control operators and having the knowledge and topography knowledge of North Yorkshire. It is a quality that we do pride ourselves on in the control room, but obviously due to us having to ask a lot more questions to the callers of where they are, it can again increase call handling times. But what we've seen over the past 10 years is a huge advance in technology. And although we've found that it has added slightly to our call handling times, it has enabled us to get a far more accurate information from the caller and location details for our oncoming crews. I'm going to just touch now on the table that you can see on the right-hand side of the slide. This is showing calls taken by North Yorkshire Fire Service and Cornwall Fire Service. We set up a resilience between North Yorkshire Fire and Rescue and Cornwall Fire and Rescue control rooms in 2016. This was a resilience option that we looked at, and we found it actually works. It works wonderfully. We basically take each other's calls and we can mobilise and incident manage for each other. We found that by doing this regularly on a weekly basis, it helps keep our control operators' competencies up with dealing with incidents in each services area. We found also that this, if a call comes in from North Yorkshire and we're having adverse weather conditions or we have major incidents, calls then will overflow into Cornwall, so Cornwall can take calls for North Yorkshire and mobilise because we are on the same mobilising system. We swap, like I just said, on a weekly basis to help our control operators keep their competencies up and keep us familiar with each other's different mobilising procedures. And due to this, when we do take each other's calls, you can see that there is a delay, and that is down to us not knowing the topography of each other's areas as well, and sometimes having to ask more questions to the callers. But what we do have in place is we constantly monitor a radio channel, so we are able to give each other assurance and guidance through the radio channel when needed. I know, John, you spoke before about how we manage the call handling times, and what we do is we run monthly reports where we look and identify certain calls that have taken a larger amount of time than what we'd like. We look at around 90 seconds and highlight any calls over 90 seconds. The control operators take responsibility for their own calls and look at the calls that have taken over 90 seconds and give an explanation as to why this has happened. We found it allows them to take ownership of their own calls, and it helps us as a management team to identify any training and development needs that may arise from looking at this report. And John, I'll hand back over to you to go on to the next slide.
Okay, thank you, Helen. So that sort of explains where we have largely seen that 6-second increase on average over the last 10 years. But hopefully that reassures actually that whilst that 6 seconds is important, what's really important is the quality of information now through the new technologies available helps us put the right appliances to the right place first time, rather than as it may have been in years gone by, people not really knowing where they are. You know, we've got road networks that run through the county, and people all often come across an incident but not quite really know where they are. Things like What 3 Words now is a real added advantage, because we can actually pinpoint exactly where they are and mobilise the correct resources. So, you know, there is a real benefit to spending that extra 6 seconds to get a real good quality type of information so that we can mobilise it accordingly. Tom and I think it's Fiona have got hands up. So Tom, do you want to come in?
Yeah, so John, I just wanted to clarify there. So what you're essentially saying is that this extra 6 seconds actually can lead to better outcomes for the member of the public at the end of the day. JD, just quickly, I mean, is that one of the things that we're potentially looking at in terms of the assurance work you're doing, so that we can demonstrate how the questions that Helen was talking about are actually helping us to deliver those better outcomes to the public?
Absolutely. This is also what we're looking for the dashboards as well, for the access to understand this. Yes.
Brilliant. Okay, so we'll get a much better picture of that going forward. That's great to know. Thank you.
Thanks, Tom. Fiona, did you want to come in there?
Yeah, I did. It was just a quick question, just in relation to what Helen said, that on the call handling side of things, and you look at anything in depth that's sort of in excess of 90 seconds. I've probably jumped ahead here, but like on looking at crew turnout, what sort of times do you look at that you think are unreasonable or sort of too long in terms of a crew turnout time? And that, I guess that would differ from a shift station to on call.
Can I just suggest that we save that question one moment? I'll explain a little bit about what this next slide is, and then I'll invite Helen into to answer that very question, if that's okay, Fiona. So the next slide we're now looking at is the crew turnout. So and as you can see, we've actually improved our crew turnout by 13 seconds on average over the last 10 years. There's a number of different things that can affect this. So as I've mentioned, the different duty systems, the shift stations, it's immediate. They're all already at the workplace, and so it's a case of getting on the fire engines and going. Or if they're out and about in their local area, they're immediately available. That's quick. The day crew, very similar during the daytime, but at night time, when they're in the on-call mode, and for our on-call firefighters, then there is generally a 5-minute rule to get into the fire station. So as the Commission mentioned earlier, this isn't about employing people that live you know, a half an hour or anything like that. We have a rule that generally states that you need to be available and within 5 minutes of the local fire station. Now, there's a number of things that can influence this. First of all, when our firefighters get in their own vehicles to drive to the station because they're alerted that there's an emergency incident, there is no legislation to, they have to sit within the law. So they've got to drive within the speed limits. They don't have blue lights and two-tones. They've got to drive within the law on the roads to get there. Things like level crossings, pedestrian crossings, other things can all influence that time to get to the fire station. And then similarly, you know, at the moment we've got a lot of frost. So if someone goes out to their car and their screen is frosted over, they've got to overcome that barrier. So there's a number of things that can affect that. But nonetheless, overall, you can see there that the times are fairly quick, and we've actually improved over the last 10 years with this one. So that's a good story. Now, how do we monitor this? Well, we do have that 5-minute rule in to get into station, but we put a little bit of a buffer on there because of some of the nuances I've mentioned. So at 7 minutes, that's when we have a procedure that kicks in. And I'm going to invite Helen back in now just to talk through that procedure, and hopefully this answers your question, Fiona.
Yeah, so in the control room, we monitor the mobile turnout times. So when we've got an incident in progress, the control operators look to see when an appliance books out. If after 5 minutes that appliance hasn't turned out, we will then start shouting them up on the radio. If we get no response from them on the radio, we'll then be ringing the mobile phone on the fire appliance and also the fire station itself. Sometimes in these instances, the crew may advise us that they're still awaiting a crew member who's en route to the station, and the control operators take into the situation the risk of the incident that they're attending, how long the crew may be waiting for the crew member, and we'll put another appliance on the incident to ensure that we've got resources promptly on the way. If we don't get to speak to anybody on the station or on the mobile phone, what we start then is our snowball procedure, which is where we start to call the on-call crew at the home addresses or on the mobile phones and ask them to proceed to the station immediately for a turnout. And whilst we're obviously busy doing that, we will get other resources on the way. How we monitor it, we have a failure to respond procedure. Generally, after a delay of 7 minutes, we will be completing a failure to respond form. After the crews have returned back to station from the incident, we do ask them why there was a delay and input this on the form, which then goes to the station manager for the crew, who addresses it directly with the crew. Does that answer what you were asking, Fiona?
Yeah, it does. Thanks, Helen.
Okay. Sorry, Helen, it's Julia. So how many snowball incidents do you get in a month, for example?
In all honesty, I can't remember the last time we had a snowball incident. It's very, 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 very rare that we do have to use our snowball procedure.
Okay, thank you. That's helpful.
Okay.
So that's yeah, the snowball side of things is really resilience, because obviously we're relying on technology, and from time to time, very rarely, fortunately, but it can fail, and so we've got that backup secondary option there to mobilise the crew. Fiona, did you want to come in further, or were you content with the answer there?
No, that's fine, thanks. I mean, I know I'm picking on the what are you doing when it's a bit longer, but actually it's a really good news story, in terms of crew turnout times, and I don't think it's probably dissimilar to other areas, other services that are have mostly shift stations.
Yeah, very similar. You know, the rural services, again, when you look at the Home Office statistics, where minus 13 seconds, so we're improved by 13 seconds, and the rural services are a similar 14 seconds. So it's a very similar picture across the board there. There is one extra procedure that we also do for monitoring, and that is occasionally we'll have an individual's pager, particularly with the on-call side of things, that didn't activate, or it might be it didn't activate, or for some reason the individual didn't turn in, and there's another procedure there that gets kicked in at local station level, whereby the local management team will investigate that to understand why. So hopefully we've assured that this particular element, the crew turnout side of things, is closely monitored, and there are a number of procedures in place to make sure that we monitor and improve performance along the way on that.
John, can I just, so I've found you an extra 10 minutes at the end of the meeting, but you do just need to speed up a little bit, if that's all right.
Sure, yeah.
Thank you.
Okay. So the next slide is to look at the drive time. And this is where overall our response over the 10-year period on average has increased by 44 seconds. And again, this is reflective really of the national picture. There has been a national increase in this area as well. So just remind, this is from the first appliance leaving to the first appliance arriving on scene. Now, there's a number of reasons for this, and if we can just move straight onto the next slide, we'll drill into a bit more about this. So, first of all, there has been an overall increased traffic volume nationally, but also locally. So within the Yorkshire and Humber region, 12.5% increase over that 10-year period. And what that's actually done is increase the amount of miles travelled on North Yorkshire's roads alone by around 1 million miles a year. So it's, in essence, that just the roads are a lot busier than they were 10 years ago. So that's one reason for it. And of course, we are, again, the largest geographical area, 3,341 square miles. So it can hinder progress getting to the incident. And the other major factor in this is the on-call availability, because we have had challenges within North Yorkshire, again, national problem as well, about recruiting and retaining on-call firefighters. And if the on-call fire station isn't available, then we have to mobilise the nearest fire appliance, and that increases drive times. So those two are the predominant reasons why we've seen increases really in our drive times. For the on-call side of things, we can do something about that. We've got a project ongoing at the moment. We're looking very closely at how we can improve the terms and conditions and how we can improve to the public our on-call service, so that we don't get that situation where the appliances are unavailable, because that's just not good for the service. It's certainly not good for the public. So we're really looking closely at how we can improve that. There's a range of other things. So, you know, sometimes we'll have ongoing incidents and then we'll get another incident close by. So that then also means that we've got to mobilise the next nearest appliance. So a whole range of factors on this one, but generally the two main reasons for that for us in North Yorkshire is the increasing traffic volume and the on-call availability issue. Next slide, please. So I talked earlier about our drive to arrive policy. And as you can see, the photograph there, that is just not the ideal scenario that we want in any emergency service. And so we have a policy in place which looks at 3 phases. Phase 1 is where we respond to non-emergency calls, and I'm talking about small animal rescues, perhaps cats up trees, loose structures, some flooding incidents. We would not respond on blue lights. We would respond, you know, with some urgency, but not on the blue lights, not in 2 tones, and we would comply with the speed limits because it's just not an emergency incident in that respect. Phase 2, of course, we would use. This is where it'd be non-life threatening or no life to property, no risk to property. So this could be a fire in the open. It could be a bin fire, some sort of a low-level incident, but still, you know, potential for it to spread. That's where we would use blues and twos to mobilise to the incident, but we would be reflective of the incident that we go into. And then phase 3 is where we know it's emergency life or probable emergency life or property risk, and that's where we would proceed with more haste, but still done in a very safe manner. Now, we mentioned earlier about how we might, how control may scale up on scale down. So again, I'm going to call Helen back in now just to explain a little bit more about that, because we do get repeat and backup calls which confirm from time to time. So Helen, would you just like to come in and talk a little bit about what you would do in those circumstances, please?
Yeah, so if we're getting several repeat calls for incidents, that often happens, car fires on major road networks. Depending on the initial call that we got and the resources there, we have got the ability to mobilise the closest resource and the nearest resource. Sometimes that can be not a fire, it could be a fire appliance that's returning from a community event. It's just outside of their area, but they can be the closest resource that we can see. We also have a system where we can track the fire appliances as well on the map, so we can see exactly where they are. That comes in really well when we're giving fire survival to callers. When we're obviously on the phone giving them that survival advice, we're able to see on our mapping system exactly where the fire appliance is. We can advise the caller they're coming down a certain street that they're obviously familiar with, which gives them huge reassurance that they know that we're nearly to them. Do you want me to talk any more, John, on that? Or?
No, that's fine, Helen. Thank you. Unless there's any questions. Okay, next slide, please. So what do we do about this? Well, we really focus our attentions on prevention. So we've got community safety officers in all of our districts, and their role really is to go into the far-reaching areas where it takes us slightly long to get to. So there is a focus on those areas through the community safety officers. We've got a public safety service trial ongoing at the moment, again in those more rural, remote areas. We've got a number of opportunities for referrals into the service and to push our fire safety message out into those rural areas using other agencies as well. And we're providing more and more training for our on-call crews to cover safe and well, safeguarding, RAP training, a number of other things that we will now arming our on-call firefighters in those far-reaching rural areas so that we can actually increase the safety of the community in the areas where it takes it longer and further to get to. And of course, the risk and resource model will again look very closely at that. Next slide, please. And so from a protection point of view, this is about the business safety element. Again, we do audits on our premises in those high risk premises which are further away from fire stations. We provide business safety audits. We provide advice on fire marshalling. We ensure that our crews are familiar with those places so that when they do turn up at an incident, or if they have to get to an incident there, they're fully familiarised with the areas, with the premises and the processes that go on there, so that they understand the urgency of getting there and are prepared. We exercise there and we carry out campaigns associated with the local rural communities, so farm safety being one of them. We focus our attentions very much so on guest houses and the bed and the hospitality industry out and again in the far-reaching areas. Next slide, please. So I'm now going to hand on to Jonathan, who's just going to talk a little bit more about the opportunities for the future through the risk and resource model.
Second. Thank you very much, John. Julia, I understand that we're covering this in February's PAM, so I won't go in depth onto the topics that we will do there, just so that we can cover it then.
Yeah, I think, Jonathan, can we just keep it quite high level, please? That'd be really helpful.
Absolutely, that's what I'm going to do. Just as a response to that one, there is no single UK-wide methodology for response, and that includes the time, the assessing, and actually assessing the risk in the communities. Our current model is based on demand only, which is very response-driven, i.e. the number of calls we attend, where we attend them, and the type of incident that we respond to. The new RRM will blend response with a societal risk, and those two maps will then help us to develop our data and intelligence for what we take it forward. Now, on the map there on the screen there, you can see the different coloured charts are actually called isochrones. Now, the isochrones are basically footprints of each station, and it tells us what we can cover in what time, and within that time, one second, my dog's just decided to wake up. You know, one of those days where you're in a public meeting and your dog decides to find its toys that you just didn't want it to happen. I apologise. So where were we? Oh dear. So yeah, those footprints allow us to have an intelligent perspective as to the risk in each area, the response, and what we can actually do to target our causal effect, i.e. our response across prevention, protection response, and most importantly, community resilience, to then deliver within there. Now, this is and I use the word intelligence because it's the start of us and the start of our journey, taking basic information, a longer journey now to embed that within the service. And ultimately, the deeper understanding we have of the communities, of our own service through performance management, the better we can report our performance and the better the HMI and everybody else can scrutinise what we're doing. Most importantly, it will then allow us to deliver and develop ourselves to make sure that we are actually targeting the people we want to. The isochrones form a base case scenario. It gives us our as-is position. It tells us what is in that area, what we need to target, and ultimately to make people, businesses and communities feel safer. All for us within our service delivery tools of the prevention, protection, response and resilience. Resilience is essential in this because those isochrones are an area for a community to focus on, to work with us, to make them stronger through interventions that we can have. And in areas where we can't do, that's where the partnership model actually comes into its own for working. The data side, just very briefly, because we're changing information into intelligence and we're starting to embed that across what we're doing, it gives us an opportunity for absolute transparency with the public and with other services and inspectors, because it gives us an opportunity to have public accessible dashboards. Now, those dashboards will be tiered across the organisation depending on the areas we want to show, but it's the first step for us to improve our digital literacy. We've already purchased some software, but we need to purchase more and we need to develop those systems in service, because then we will have the outcome, or one of the success factors for us is that the public have a responsive online portal for them to understand what we're doing and how we're doing it. More importantly, they'll be able to understand our prevention, protection and the tertiary aspect of response for what they can receive. That then is the service and the public coming together to try and collectively reduce harm to themselves and the risk that they're doing. The evaluation framework will assure and evaluate that and provide the outcomes for the care model and also into the HMI. And we have used benchmarking against other services, against health services and police on some of the data sets to look at our comparison. And just as an assurance on the process that we're doing, it is within the NFCC best practice, the trade unions best practice, and also we're working to align ourselves to the NFCC's community risk programme as well.
Sorry, the NFCC, Jonathan?
Sorry, National Fire Chiefs Council.
Thank you.
They are producing or aiming to produce for the first time a national toolbox which will drive a single model and toolkit for response to try and stop there being 45 different ways of responding to a fire. And that's everything. Thank you.
Okay, thanks. So I just sort of want to put this a bit in context, could I? Because I think it's important. So there's quite a lot of jargon in all of that. So the integrated response, the IRMP plan, that is a statutory plan that the fire service has to produce that assesses the risk that it has in its different communities, that allows the fire service then to decide where it puts its resources and its assets. So I just think we needed just to explain that, and that has to be done in regular intervals. And we're now at that point where our IRMP is about to run out. So we need to do a new one because it's a statutory document. and there will be a consultation period in the spring when we go out and we talk to people around the risks that we've identified in communities, see if we've missed anything, and then come up with our proposals for resourcing in the future. So that's the point in time at which we are at the moment, and I think it's important just to explain that to the public. And secondly, that we've called our IMP a risk and resource model, which is just to be clear, because that's what we believe it is, and that's a better name for that statutory document, which is, sorry, JD, I just felt that needed a little bit of explanation. Andrew, you want to come in?
Yes, please, Julie. You've teed me up nicely there. Yeah, the risk and resource model does what it says on the tin. We profile the risk across York and North Yorkshire. That's the first R of risk and resource model, RRM, and then we decide how to resource to best manage that risk. And it harks back to what John said at the very beginning, which was before 2004, there were standards of fire cover that really dictated where we placed our fire stations and the type and number of fire engines on each of those stations. But those standards of fire cover were based upon the building risk and only the risk from fire in those buildings. It didn't consider any of the other hazards that we respond to, and it also didn't consider the risk to people. It was all about the fabric of the building. So that creates something of a sticking point now, because the public have understandably come to expect that the fire station and the resources on that station that they've got and have always had, that they should always have. And when we go out to consult on that new risk and resource model, we might suggest changes because we think that there's a better way to resource that area or a different type of equipment or fire engine to have for the risk to people in that area that was never considered when these fire stations were first built or when those fire engines were first put on them. So there's something really important about the public understanding that history and where we are now, so they can recognise that what we're doing is seeking to resource in the best way to protect them as people. And then in terms of lots of what you've heard today from John and Helen, and thanks John and Helen, you did a brilliant job there of explaining how all of that operates. I don't lie in bed at night, Julia, and worry that firefighters and the control operators are doing anything to delay the response. It's in the very DNA of control operators and of firefighters to respond as quickly as they possibly can. Nobody puts anything to delay. So that what would concern me about an arbitrary target time would be that it would drive inappropriate behaviours, things that either cut corners or that were less safe. So I would far prefer that we got the quality and the speed balanced appropriately, rather than have something that drove people literally and metaphorically to just go quickly without thinking about the quality or the safety aspects around that. So what I'm keen is that we can demonstrate that we are able to balance speed and quality in each of the three areas that John and Helen talked about: call handling, turnout and mobilisation, to make sure that each section is done as quickly as it sensibly and safely can be. But that's just really to sum up what they were talking about earlier.
Okay. Andrew, we really need to move this on because we've only got 10 minutes now. So John, are you going to do the performance presentation?
I will do.
John, can you just do it by exception, because we really do need to. We've sort of strayed into a discussion about the IRMP, which is probably for another meeting. So let's just focus a little bit on and get through it by exception, if that's possible, please.
Yep, thank you. So I will go through these quick as I can. So nothing major to report on this other than a reduction on the number of calls over the past month, and that's reflective over the quarter. Just one piece of information on that one to look at. We have noticed that we've now started to increase the amount of calls to assisting other agencies. So as an example, and it's not actually on that slide, from the 1st of January to the present date, we've responded to 34 incidents to gain entry into property for both police and fire service. And that's, that's fine. But I think it's probably reflective of the demands that other services are under at the moment due to COVID. and we'll monitor that closely going forward. Next slide, please. This is an automatic fire alarm overview. It sort of shows the last 2 years and how they went up slightly in 2019, but came back down again in 2020. But that's largely reflective of the COVID situation. But again, we'll monitor that more closely. Next slide, please. This is just a breakdown of the terminology of false alarms. So we get false alarms, which are generally automatic fire alarms. We get false alarms, which could be people seeing things, reporting them, but it actually doesn't turn out to be a fire at all. And then we also get malicious calls. So that just shows there that the majority of those are automatic fire alarms. And if we can just go on to the next slide, please. This slide here just shows very quickly how the balance of those are. And so it shows the proportion of the false alarms that we get both in commercial and residential properties, and the balance between the system faults or activations of the alarm, which is intended to do, but by misappropriation. So it could be burnt toast. That would go down as a system activating correctly. But then that gives us an opportunity to work with the residents to change habits, etc. Next slide, please. So this shows our overall fire cover for the month of December. December's slightly lower than November, but again, overall, we're in a better place than we were last year. And again, this is partly reflective of the COVID lockdowns, because that does increase our overall on-call availability. Next slide, please. This shows our overall on-call availability, again, 84% compared to 88%, slight reduction from November in December. One thing that we have had is good recruitment. So we've had 3 recruit drives and 3 recruit courses. So our staffing levels are improving. However, to get these people fully competent and so that they fully count, and then we'll see a real improvement in our availability, can take anything up to 2 years. And so training course availability is an issue at the moment, which we are looking at. Next slide, please. This slide covers our community safety overview. And you'll see there the grey line on the left-hand side showed an increase in our safe and wells. It dropped back over because of the COVID side of things, but it shows there that we were starting to get back out into the community. And then, of course, came another bout of lockdown in November, and then where we currently are. So that is a fluctuating story all the time. But we are now picking up again more calls to do with the shielded people and keeping in touch with them. And that work is ongoing through North Yorkshire County Council as well. So crews are actually telephoning members of the shielded community up and making sure they're safe and well at home. Next slide, please. This slide covers our business safety activities. And again, we have been in a place where our outputs were lower due to COVID. They did start to improve towards the back end of last year, and again, because of the lockdown, they've had to readjust and realign. But nonetheless, we've got procedures in place now. We're following all the NFCC guidance on this, and we will scale back up again as soon as we possibly can do once lockdown restrictions are released. And then the final slide, please. So this is just showing our overall absence levels, and I put this in particularly for showing the grey line along the bottom. And that just shows the picture from when the COVID outbreak first came in sort of March, April last year, and how overall we'd had a very, very minimal impact on the service in terms of positive cases. But today we've had 37 positive cases, and it shows you in the last sort of back end of December how that really ramped up there. We suffered more so within the service with positive tested cases and knock-on effect that brings within the workplace. So that, it's not huge figures, but it shows the scale of how it increased. And then an example being on the 13th of November, we had 9 people as a running total. And from then until the present date, it's gone up to 37. So it's been a real increase in the last, in the back end of 2020. It's stabilising now. We're still managing to respond. It's not affecting anything in terms of response whatsoever. And that's it. So happy to take any questions. Fiona.
I just had just a quick question around. I think you've done really well, haven't you? In terms of there've been very few confirmations of workplace COVID transmission. Yeah. So that good point, Fiona. We've had one confirmed workplace transmission, and that was associated with the training centre. And that is what we call RIDDOR, reportable report of injuries, disease and dangerous occurrences regulations. So we have to report that through to the HSE. That is the only one that we've had, which we've done down the RIDDOR. So whilst the larger amount of our positive cases has been within the on-call crews, that is largely associated with their primary employment and other lifestyles. Our on-call, our whole-time crews, the transmission rates there have been very, very low.
Okay, fantastic. Thank you very much. So I think we've reached the end of those presentations. Helen, thank you for joining us for the first time. It is appreciated, and for your work and all the team in the control room's work. You do a fantastic job. So thank you very much. Indeed, and thank you to John, Andrew and Jonathan for those presentations. It's much appreciated. I think we've covered, I've just gone back and checked all of the questions from the public, and I think we've hopefully covered all of those off fairly comprehensively. And I'm hoping we don't have any other business, because we've got about 10 seconds left. Anybody got anything else they'd like to raise? No. Well, thank you again. Thank you to police colleagues. Thank you to fire colleagues, and everybody who put all the work into those presentations. Very well done, and nice and clear. So thank you very much.